Welcome to Healing Horizons. I am Chris Daniels, your host. Today's episode is not your average detox. Ibogaine, in Mexico for PTSD, opioids, and military trauma. We explore what Ibogaine is, how it works, who it may help, and how to pursue it safely. I will translate the science, share real stories, and give practical steps. This show is educational only. Please consult medical professionals to decide whether Ibogaine is appropriate and safe for you. Ibogaine is often called not your average detox because it can interrupt withdrawal and cravings while opening a window into the emotional roots of addiction and trauma. Many people report significant relief from opioid withdrawal within hours, alongside vivid insights that reframe their stories. Rather than replacing a drug or white-knuckling through detox, Ibogaine invites meaning-making. It is not magic, yet it can catalyze change when paired with preparation, medical safety, and aftercare. Ibogaine comes from Iboga, a West Central African shrub central to Bwiti spiritual healing. In the 20th century, Western researchers noticed its ability to interrupt opioid dependence. Modern clinics developed medical protocols, separating respectful tradition from clinical practice. Mexico became a hub because Ibogaine is not scheduled there, allowing licensed physicians to bridge medical oversight with harm reduction. Proximity to the United States, established clinics, and integration networks have concentrated expertise along the Mexican coastline. Once ingested, Ibogaine is metabolized in the liver into norbogaine, a longer-acting compound. Together, they modulate neurochemical systems, including serotonin, dopamine, and kappa-opioid receptors, and may normalize glutamate signaling. Many describe a neurochemical reset. Withdrawal eases, cravings quiet, sleep, and mood begin to stabilize. The psychedelic phase can surface autobiographical memories, allowing emotional processing. Ibogaine extends relief over days to weeks, creating a window for therapy, rest, and rebuilding routines that support recovery. Conventional detox aims to manage acute withdrawal with comfort medications, often followed by maintenance therapies like methadone or buprenorphine. Ibogaine differs by interrupting withdrawal and cravings in a treatment arc, often within 1 to 3 days, while inviting insight. That does not make it superior or a replacement for medication-assisted treatment. Many people still benefit from ongoing medications and therapy. Ibogaine can be a reset button, but recovery requires aftercare plans and daily practice. PTSD and military trauma add layers that ordinary detox cannot touch. Hypervigilance, nightmares, and moral injury can drive compulsive use. Ibogaine induces an introspective, dreamlike state where memories may be revisited without being overwhelmed. This can support memory reconsolidation, the brain process of updating old memories with meaning and context. People report a sense of forgiveness, grief, and clarity. These shifts do not erase trauma, yet they can reduce reactivity and open doors to therapy. Veterans often carry co-occurring traumatic brain injury, chronic pain, disrupted sleep, and moral complexity. These factors shape screening, dosing, and monitoring. A trauma-informed clinic builds predictability into the process, limits sensory overload, and staffs providers who understand military culture. Medical oversight should include neurological history, pain planning, and sleep strategies that do not conflict with Ibogaine safety. Coordination with a home clinician or veteran services can extend continuity of care and support stability. Who may benefit? People with opioid or polysubstance dependence, trauma-linked patterns, or depression and anxiety that have resisted standard care. It can also help alcohol or stimulant use when trauma drives cycles. Expectations matter. Some feel relief, others experience partial improvement and need additional care. Ibogaine is not suitable for unstable psychiatric states, chaotic medical conditions, or those unwilling to engage in recovery. It can open a door, but you have to walk through. Safety first. Before considering treatment, get a full medical workup. EKG to check QT interval, electrolytes, liver function tests, pregnancy test if relevant, and a thorough medication review. Bring any cardiac or neurological history. During treatment, best practice includes continuous cardiac and pulse monitoring, oxygen on hand, IV access, and a physician on site. Dosing should be individualized using weight, EKG, and clinical response. Clinics must have emergency protocols and formal transfer agreements with hospitals. Contraindications include significant heart disease, prolonged QT, uncontrolled hypertension, seizure disorders, serious liver disease, and pregnancy. Caution is warranted with active psychosis, bipolar mania, severe eating disorders, or recent strokes. Recent use of long-acting opioids, stimulants, or serotonergic combinations can increase risk. Never combine Ibogaine with other substances. Tapering plans, designed by physicians, reduce risk. If your health is complicated, consider alternatives or staged care that first stabilizes health before exploring psychedelic-assisted interventions. Medication interactions require planning. Methadone and buprenorphine often need gradual transitions to short-acting opioids or holds before Ibogaine. Many antidepressants, especially SSRIs, SNRIs, and bupropion, can inhibit enzymes like CYP2D6 or affect cardiac rhythm. Tramadol, stimulants, antipsychotics, and antibiotics may increase risk. Benzodiazepines complicate dosing and recovery. Never stop medications abruptly. Work with a physician to coordinate tapers, washout periods, and bridging strategies that maintain safety, pain control, and stability during preparation and integration. What does a high-standard Mexican clinic look like? Licensed physicians present on-site, hospital-grade monitors, IV access, defibrillator, oxygen, and medications for cardiac and neurological emergencies. Screening includes EKG and labs before scheduling. Dosing is guided by weight, EKG, and clinical response, with a test dose before any larger administration. Informed consent outlines risks, alternatives, costs, and aftercare. Integration support begins before arrival and continues after discharge, with outcomes tracking and pricing policies. Red flags include no medical screening, rushed timelines, miracle claims, cash-only pressure, or refusal to coordinate with your doctor. Be wary of providers who minimize risks or promise guaranteed cures. Preparation matters. Plan medical workups, medication tapers, trauma-aware preparation, and an aftercare roadmap. Clarify intentions without expectations. Build a support system at home. Confirm travel logistics, lodging, and timelines. Arrange follow-up therapy before you leave, so momentum and safety continue after treatment. The treatment arc usually includes pre-care education, a small test dose to assess sensitivity, then a larger flood dose administered with continuous monitoring. During the acute phase, you lie down with eye shades, supported by clinicians, while the experience unfolds. Afterward, expect fatigue, light sensitivity, and emotional openness. Hydration, nutrition, and rest are prioritized. Boundaries protect sleep. Within days, integration begins, with therapy, community support, and planning anchored to the insights and relief you experienced. Integration turns insight into action. Trauma-focused therapies like EMDR, cognitive processing, or somatic work help reconsolidate memories and regulate the nervous system. Some people continue medication-assisted treatment or antidepressants when appropriate, coordinated. Community matters. Groups, veteran organizations, or communities can sustain connection. Rebuild sleep, nutrition, and fitness gradually. Service and purpose restore identity. Expect ebbs and flows. When cravings or nightmares return, go to basics, ask for help, and recommit to structure. 3 brief stories. First, an opioid-dependent father reported minimal withdrawal, deep grief for lost years, and renewed presence with his children. He still needed physical therapy and counseling for pain. Second, a combat veteran experienced fewer nightmares and less startle, plus motivation to reconnect. He continued trauma therapy and sleep rehabilitation. Third, a woman using alcohol to numb childhood trauma felt compassion and reduced cravings. Boundaries, nutrition, and a women's group became her practice. Research remains promising yet preliminary. Observational studies and case series show rapid opioid withdrawal interruption, reduced cravings, and improvements in depression and PTSD symptoms. Randomized trials are limited, and long-term outcomes vary. Adverse events, including cardiac arrhythmias, have occurred, often linked to inadequate screening or interactions. Ibogaine is not approved by the Food and Drug Administration. Continued clinical trials, registries, and reporting are crucial to determine who benefits most and how to minimize risk. Why Mexico? Ibogaine occupies a legal gray area, and Mexico permits clinical use under medical oversight. Ethical practice means transparency about risks, evidence, and limitations. Traveler safety matters. Verify the clinic location, emergency services proximity, and transportation plans from airport to facility. Share your itinerary with family. Arrange cross-border continuity of care, returning to a physician or therapist who will review labs, adjust medications, and support integration. Always prioritize safety over speed or convenience. Actionable next steps. Interview clinics. Who are the physicians? What monitoring is used? How are emergencies handled? What are dosing criteria? And what aftercare is provided? Ask for outcomes and references. Speak with your physician about labs, medication plans, and cardiac risk. Build a safety net. Therapy, peers, family, and supports. Put aftercare appointments on the calendar before traveling. Keep crisis resources handy, including emergency numbers and hotlines. This episode is educational, not medical advice. That is our look at Ibogaine in Mexico. We covered origins, science, differences from conventional care, PTSD and veteran considerations, safety screening, contraindications, medication interactions, evaluating clinics, preparation, the treatment arc, integration, real stories, research, and legal context. My goal is to give you clarity, language for clinician conversations, and a roadmap for safe next steps. I am Chris Daniels. Thanks for listening to Healing Horizons. Be well, stay curious, and stay safe. Take care.